talking about fillers, and we're talking here about Juvederm. And Juvederm has been around for quite a while, and Juvederm comes now in different forms. Juvederm is a hyaluronic acid-based product, and we have hyaluronic acid in us. We have, it's a natural product. It's a product that has no risk of allergy or reactions or anything like that. The truth is that in all of the years that I've put Juvederm in people, I have never seen an allergic reaction. And the reason there's no allergy is to proteins, and there is no protein in here. It depends on which Juvederm we're talking about. Juvederm is used as the filler in different parts, and it comes in different consistencies and thicknesses and how soft or not so soft. It depends on where it's going to be used. Once, for example, if we're doing it in lips, we want this softer. If we're using it in supporting chin, harder structures like cheeks, where it's placed deeper, we need a firmer product. And it depends on which one of those products that we're using, and it depends on where we're putting it. It has a longevity that's somewhere between 6 months to a year. Voluma could last longer. It doesn't really stay as much as the 2 years we hope it stays, but it does stay longer. Juvederm products do a wonderful job when they're placed in the right indication. Juvederm products are used in chin augmentation, in lip enhancement, in softening of nasolabial folds. It's used in the temples for people that have been too anxious to lose weight and wind up with low atrophic temples, and it can improve it. The cheeks can be improved, the jawline can be improved. Again, you have to decide where you're using it and which of the Juvederm products you're using. Juvederm also is used, of course, this is the biggest request we get. This is the biggest request. Now, I for myself think that if the lip fillers are done appropriately and are not overdone, and we don't overdo here, it looks very natural, and it gives a very attractive addition to a face that has thinner lips. For the jawline, where we use it, it's in trying to minimize the need for surgery. So what do? We put it, for example, in this dip here to try to minimize that dip, to make it less, so we can put it along the corner of the jaw to come up with that better definition that you see here and here. We can, you see how it's distributed to soften areas that have had a little change, whether there is an atrophy there or whether the sagging of what's above it led to the appearance of that little depression. Juvederm is done in facial balancing, and what we're talking about is to improve the cheek area. We're to improving the nasolabial area. We're talking about improving the marionette area, the lower part of that cheek chin fold, and it really is. So if this person had 8 syringes, you would think that they should look so abnormally overdone, but they're not. They're not, because it's placed well, it's placed in the right locations. The liquid rhinoplasty is a wonderful, wonderful choice that can come to rescues. I've had requests for people that have weddings coming up and they don't have time to have a rhinoplasty. And essentially, the way this lady benefited from a liquid rhinoplasty is to fill this dip here. And by filling that dip, she has a perfectly straight dorsal line. Something special about putting the Juvederm in the nose is that it lasts a lot longer than it's supposed to anywhere else in the body. Not sure why, but possibly because there is no mobility in the nose, so it doesn't get consumed as when you put it in a lip or when you put it in nasolabial fold with all the movement. It gets pushed around and it gets absorbed faster. Yeah, this is to enhance the cheek, and if you look, you see how it's a little flatter there, and here it's a little fuller, and you can see it more on this cheek. So these are applications where we put the filler deeper in the tissue. It's placed against really the cheekbone, and it gives the impression as if the person has a fuller cheekbone in there. How do they work? It's a volume replacing. Again, hyaluronic acid, they say that it absorbs water, it attracts water. So when we put it in, it pulls humidity from the soft tissue around it, and it gives that additional enhancement to the location. In many cases, Juvederm can enhance collagen production. Many of the fillers are now being studied more and more to see their effects on the self-collagen production, not just as in volume. Our friends from Oregon came up with a word that I hadn't known before, which is volumizer. So it adds volume. It adds volume, yeah. Again, the results depends on the placement techniques. You saw that picture where the lady had 8 syringes at a session, and the truth is that they were placed in such a way that you don't see anything overdone. It all is the norm. 1 syringe of Juvederm, old Juvederm, comes in a 1 cc syringe. So people are always anxious, am I going to be overdone? Am I going to have? Nobody's going to be overdone with a syringe of Juvederm, but these are approximations of what is a 3 cc and what is a 1 cc and what is a 2 cc's. Juvederm has one product which comes in a half a cc syringe, but it's a different product. It's a very soft product. It is for lips, but it is not to make lips bigger. It's to soften smokers' lines or these fine lines around the lips. cc syringe. Who's a good candidate? Who's not a good candidate? Anybody that has lost volume is a good candidate. Anybody that wants to enhance a given part of them is a good candidate. If anybody thought that they're now over 30 and some of that fat pad in the cheek had moved down, we can enhance it. Some people describe how their lips have gotten a little thinner over the years, and they can be brought back to what for that particular face is an ideal lip look. Age, how young, how not so young should you be to get it? The truth is that there are no rules. Fillers can be done as requested. If I'm looking in the mirror and I think this part of me could look a little bit better if it was a little fuller, then that's the place and that's the indication. There is no too young there. I'm not going to be putting fillers in kids, but you know, when the 19-year-old shows up and says, I want a little enhanced lips, what's the reason to say no? There is probably not a reason to do that. And as long as we all have a good understanding as to what we're trying to accomplish, then that's what it is. You want to talk about those conversations about Juvederm not going away?
I mean, I tell patients that it's a nice option because if you like it, you can have it again. If you don't like it, it'll go away. I think in most patients, the different products have different durations. So one of the more popular products for the cheek is Voluma. I think the company says it lasts like a year or
It's
longer.
up to 2 years.
So we have an expert here. And then like my father was mentioning, for the lips, there are different products. There's something called Volbella, which is designed for the lip, and that lasts, I think, 6 months or more.
1 year.
1 year even. So I think it's whatever the company says, come a little bit less than that, but they are durable.
We translate their words.
Yeah, but they are durable, and like I said, most patients do end up coming back to have it again, so it becomes part of the maintenance. And yeah, there is a way to dissolve the hyaluronic acid filler, but fortunately that's a rare event. That's something you need that. So they're safe. Everything that he talked about has a very safe side effect profile. I haven't really seen significant allergic reactions. Just about anybody can have a filler, like you mentioned, and they're effective. Like you saw in that slide with the fruits. The blueberry is zoomed in here. It's pretty big, but in fact, the blueberry is quite small, and so just a little bit of filler can go. Yeah.
Yeah, that's one syringe of filler.
Yeah, there it is to scale, and this can go a long way when you're talking about subtle enhancements, whether it's the cheek, the nasolabial fillers, or the lips. That's where I use the fillers the most, and I find them to be very effective.
This is a conversation, Sal, about what's the difference between Botox and Juvederm, because people come and they want a filler, but they think they should get it from Botox, or they want to have their wrinkles improved with Botox, but they're asking for a filler. It's two different things. It's just two different things. Botox is called a neurolytic. It works at the juncture of the nerve with the muscle fibers, and it blocks that juncture. And it means that when I am trying to make faces, I'm not able to create that wrinkle in my glabella area. I'm not able to do it because Botox blocked that nerve to muscle connection. It's a neurolytic and it works. Now, what are the indications for Botox? There's a million indications for Botox in facial aesthetics. It's mostly used in the glabella. It's also used in crow's feet. It's used sometimes it's used for forehead lines. It's used sometimes in reversing a real gummy smile. It's used in the depressor muscle at the corner of the mouth at times to minimize the downgoing smile that sometimes we have. It is also used, that's not an aesthetic use, but in people that grind their teeth to weaken that grinding. In those patients, it can aesthetically be beneficial. In those that have a square face by weakening the masseter. So that's working on the muscle and the grinding, but also has an aesthetic effect. It has many other medical indications. You know, Botox was first used in ophthalmology for people that are cross-eyed. And that's how it started, and somebody was putting it there and realized that it improved lines. And that's how it started.
Is it used for headache?
Yes.
It's used
It's like one of the most versatile drugs in the world. It's got so many indications for so many different conditions. I mean, people use it, for example, in the bladder for certain problems. So it's also very safe. We use it just for cosmetic purposes, and like my father was saying, when we're talking about unwanted lines, the upper face, in between the eyebrows, we get those vertical creases. In the forehead, we get the horizontal creases, and around the eyes, we get what they call crow's feet. All of those lines are a function of muscle contraction. So when your corrugator muscles contract, they squeeze to the middle, like you're focusing on something, you're frowning. Your frontalis muscle lifts up the eyebrows when you're expressing yourself. And when we smile, the orbicularis oculi muscle will contract and we get those lines. Like he said, the Botox temporarily paralyzes those muscles. It sounds scary, but it's effective and it's safe, and the effect is such that you get a smoothing out of those areas. I talked about all the FDA approved areas, and he, yeah, and some of the other ones he mentioned are FDA approved. But I think of Botox as being a way to treat the upper face. And then this slide is talking about when would you use Botox when you use fillers. So Botox for the upper face, fillers for the mid face, and the lower face. So the Botox, I think the company has a nice brochure where it says like smooth, lift, and plump or something like that. So you're smoothing out the upper face lines with the Botox. The only people we don't give Botox to are women who are breastfeeding or potentially pregnant. And that's only because there's no studies that talk about is it safe with regard to transmission to the baby. But again, I haven't seen allergic reactions. I find it to be a super effective, safe drug. But yeah, Botox for the upper face. You can use, again, a cheek filler to augment the cheek, and at the same time as you're augmenting the cheek, as in that picture we have that person who actually, you'll see her here walking around. You notice that her fold got a little bit blunted, partly because they put filler in her fold, but partly because they augmented her cheek. So that lifts, right? If you go back. I'm sorry, back for you. Yeah, there she is.
Yeah.
So if you look, I mean, this is a great picture because we didn't mess around. The lighting's the same, her makeup, level's the same. The difference is just the filler. And if you look how heavy her nasolabial fold is, it's a lot less in this picture. And part of that is because they injected filler in the fold, and part of that is because they injected filler in the cheek. So smooth out the top of Botox, lift the mid-face, and then you can plump the lips. You can see they augmented her lips too. But you can go back to that Botox, which is beautiful. So they do complement each other. I think they're both effective in their own ways. Some people, it's based on the patient's concern. Some patients are only concerned about seeing these creases that used to be sort of temporary. Now they seem to be hanging out longer. So it's not just when you're expressing yourself, it's there without. And that's why we have a lot of young people doing Botox, because they're trying to stay ahead of it. They don't want to wait for that crease to settle. But others are concerned about volume and feeling like aging has caused some atrophy, some loss of that soft tissue, some sagging, so that you get some lift to the filler. Next slide, I think. Yeah, so I think my father mentioned it, and the slide mentioned it too. You will see some scary looking pictures of people on the internet who had too much of these things.
Or place in the wrong place. Or
that's just not our style. Whoever is injecting you, the goal is to be conservative. The goal is to try to treat the problem that the patient is concerned about, and you can have that done and not look like you just left the medical spa. You can look refreshed and with Botox and still be expressing yourself. You don't look frozen. You can have filler and not look, doughy. So, yeah.
I'll probably have over 6 syringes in my face. And
There you go.
people don't believe me when I say that, but it's just placed appropriately and all in respect to the other areas. That's sometimes the unnatural outcomes are treating one area without addressing another area. For example, we talk about temples, and most people don't really come in asking to treat their temples. But if we treat their cheeks and they have a hollowing in their temples, it might make that area look even more deficient, right? And that's where people start to look cheeky, and that kind of seems unnatural. Similar with the lips, if we really give someone a fuller lip, but they have a more recessed chin, it might make that more noticeable. So treating areas in harmony, sometimes we'll just keep it, that more balanced look. So that's when I did my treatment. It was a lot about just giving a little bit of more length to my lower face. And to do that, I had to place, filler along my jawline, in my chin, and even in this chin shadow to just kind of get a little bit of lengthening down there. So not coming in and getting a crazy big chin, nobody wants that, right? It's just kind of looking at my natural features and where we can just enhance them and balance them out a bit.
I don't want to miss talking about, you mentioned neck applications for Botox.
Yeah.
And I don't want to really miss talking about that. It's a thing that we've been doing off-label for a while, but of late it's now an approved application. And what we're talking about is those of us that wind up with what's called platysma bands. Platysma band is these muscle vertical bands that we come up in our necks, and those it's shown now that Botox can soften these bands and can minimize, forgive me, the aging effect that I and people like me have from that platysma. So it's a neck application, and it's not a minor thing. It's very good and effective.
Yeah. Very popular now.
Yeah, and the point of this slide is that if you do come for a consult, we want to get to know you as a patient, get to know your history, make sure, again, that we understand what your concerns are and come up with a personalized treatment plan. All right. Any questions about any of that? Thanks so much for your attention.
We appreciate taking the time to show up, and if you still should have a question that comes up later, call us, we'll answer.
That's the best question.
Okay.
We might have availability tomorrow.
Yeah, we can answer that too.
Thank you, doctors. Thank you so much. Thank you. Thank you. For anybody watching, if anybody wants to purchase, we have some specials you can call in. When you call in, just let us know that you watched the live. We are doing Tox. Botox is $10.99 a unit. Z-Men is $8.99 a unit, and Discord is $4.99 a unit. We're also doing dollars off of areas. So we have cheeks. We have temples, cheeks, jaw, chin. We can do the liquid rhino, like the slide that we had before. We have lip half a syringe, lip full syringe, and we're also doing a special on lip foot. So if you're interested in anything, please call the spa, 732-739-3033. Thank you. Have a good night.
Thanks.